This is Dr. Keith Hare presenting today on cecal and sigmoid volvulus as part of the Emory University School of Medicine's 22 Don't Miss Diagnoses in Radiology. Both cecal and sigmoid volvulus represent twisting of bowel on their attachments to the mesentery. Due to the often dramatic subsequent bowel obstruction, these entities can often be detected or at least suspected and distinguished from one another on plain film radiography or CT. In the case of cecal volvulus, there is twisting of the cecum, which normally lives in the right lower quadrant, such that this dilated segment of colon is often seen extending to the left upper quadrant. In this radiograph, a massively dilated loop of bowel without its typical haustral markings extends from the right lower quadrant to the left upper quadrant. The larger convex portion is said to point to the left upper quadrant. In the following example, a large featureless loop of bowel is seen filling much of the right hemiabdomen. In this case, the larger convex portion points to the right upper quadrant. However, it appears to originate from the usual location of the cecum in the right lower quadrant. In addition, due to the inability of bowel gas to pass beyond the twisted cecum, dilated loops of small bowel are seen in the left hemiabdomen, representing small bowel obstruction. The small bowel is confidently identified by presence of folds which span the diameter of the bowel lumen. These folds are known as valvulae connivents. Image on the left demonstrates a dilated loop of cecum, again pointing to the left upper quadrant. Additional loops of dilated bowel likely represent small bowel, which is so dilated it has lost its valvulae connivents. The image on the right also shows a dilated loop of cecum pointing to the left upper quadrant. Note also a long air fluid level within the dilated cecum in this upright abdominal radiograph, representing a buildup of colonic fluid layering under air which are trapped within the volvulus. In the case of sigmoid volvulus, there is twisting of the sigmoid, which normally lies in the left lower quadrant of the abdomen, such that this dilated segment of colon is often seen in the midline abdomen or even pointing to the right upper quadrant. Sigmoid volvulus has a characteristic radiographic appearance, often referred to as the inverted U sign, with the valley of the flipped U pointing towards the right upper quadrant of the abdomen. Another typical appearance of sigmoid volvulus is the coffee bean sign, with the outer margins of the coffee bean representing the lateral margins of the twisted sigmoid and the coffee bean cleft representing the superimposition of medial walls of twisted bowel. A barium enema can often suggest sigmoid volvulus when contrast that is instilled through the rectum tapers to a beak at the point of twisting. In these representative cases, some contrast is able to pass beyond the area of twisting. A single axial slice through the lower abdomen with rectal contrast demonstrates beak-like termination of contrast within the segment of sigmoid colon distal to the area of torsion.